I'll say a prayer. Father in heaven, we ask that you might lead us again tonight in knowing how to deal with skin problems. And we pray that your spirit shall be our teacher. We pray in Jesus' name. Amen.
Amen.
So this is
Amen.
a long one. I want you to pay attention. I'm going to have to share these slides with us, but we'll not be talking about all of this because these are 93 slides. So are we going to be living with skin problems? We can't live with them. We need to eradicate them. The next question that informs this is then, what is the solution? So let's go. For general skincare, this in a nutshell is what you need. You need to care for the skin. It defines your identity, gives you confidence. There are people that when they're down with certain skin conditions like acne and pimples, then their esteem is drastically lowered. And we don't want that because their life is going to be affected in one way or another. That's not very appealing. So general skincare is important. You want to pay attention because the skin serves as a window to your lifestyle. It's an indicator for how your lifestyle runs. Eat, work, exercise, rest, take care of your liver. I told you guys, the liver is basically the one that protects major organs of the body, and the skin is not an exempt, or the integumentary system. Remember, we said the other day that the integumentary system is the skin plus the hair, the nails, the plantar surfaces, and of course, the associate glands, including the mammary gland. So, how do we take care of our skins? We need to work, we need to rest, we need to exercise, we need to take care of the liver. How? Avoid oils, fats, and fried foods that will slow down the activity of your liver hepatocytes, liver cells. Take a cold shower. This is important every morning, and a warm one at night. Use less soap and never use strong soaps. Ladies, you got your information there. Don't use very strong soaps. Water. We can do some hydrotherapy applications. Some of you will want to get out of their way and look for water therapy manual. And there are recommendations there. So for skin diseases, you do a short cold but a full bath. A full bath means kila sehemu ya mwili imepata maji. And there are restrictions when you buy this book that will inform you on how to take a full bath with skin conditions. Let's go. By the way, it's called because warm could trigger the oozing out of lesions on your skin. General skincare, blah, blah, blah. Let's go to the next slide. Did that come out twice? Burns. For burns, you do an evaporating compress. When we'll be learning at the therapy, we'll know in detail what evaporating compress entails. This called irrigation compress, wet cloth over the area, and what have you. I don't have time to go through this because I have other things to do. Dry skin, sweating, wet sheet pack, oil rubbed on the skin, cold meat and friction. That means cold towel rub, wet sheet rub, blah, blah, blah. Let's go. We don't have time for all of that. These are 93 slides. When you go to eruptions on your skin and the skin is dry and irritable, prolonged neutral bath. So you're going to have this to look at your own time. Once again, I have to emphasize. Let's go, dancer. Just pass that. Just be passing, be passing. This is hydrotherapy. This is hydrotherapy. Hydrotherapy just... So when we have a skin condition where there's a bruising, and I tried my best to put up a picture out there for you. What is a bruise? The skin is not broken, but the tissue under the skin is injured. I mean, the tissue that has been affected is injured. Then there might be pain or swelling and sometimes blue, black marks. Contusions is the other name, but it occurs when the skin is not broken. Blood vessels have been ruptured, so that is like the second layer, the dermis, because the dermis is that second layer of the skin that houses the nerves and the blood vessels. And of course, when you rupture the blood vessels, blood is released into the surrounding tissues and the skin is not left out. How do we treat bruisings. Immediately you suffer this injury, an ice pack on the bruised area, keeping it there for 30 minutes does wonders. Then it won't swell. But if there is swelling, that means there is more damage from the bruise. So later, as you apply your wet ice pack, you can put a poultice of fresh and dried greens. So basically, any green leafy veggies would work. Oatmeal, basically oats, because they are alkaline. Wheat bran, that's also alkaline. Comfrey, that's good on the skin, especially when you're talking about wounds. And charcoal, which has the ability to neutralize and to pull out toxins, is what you pulverize. So you pulverize the charcoal, or you poultice the charcoal by after making it into a wet paste and encase it onto the affected area with a cloth. And sometimes we are quite restrictive on which kind of cloth you're going to use to apply activated charcoal on the skin, because anything other than white colored material is going to be bleached, and because charcoal is like a dye, and that chemical color of whatever material you're using is going to get into your body. Put it for several hours, repeat until the bruise is cleared. That can go even after 3 or 4 days. Let's go. How are we going to be preventing bruises? Sometimes the skin is weak. Strengthen the skin and the blood vessels by eating a nutritious diet of green leafy veggies and fresh fruit. There is a grain that we call buckwheat, very helpful, and vegetable juices, especially carrot, celery, and beetroot. Take vitamin C. Vitamin C has this effect of on excess precipitating a running stomach. Inafanya uendeshe. Sasa chukua vitamin C as long as you tolerate it, and be sure that it has bioflavonoids. Bioflavonoids are basically cloud of electrons in like lemon. So the vitamin C in lemon does not harm your cells. Vitamin E, I mentioned to us, I believe that vitamin E would come to us from sunflower oil, sunflower seeds, coconut oil, or coconut as a fruit or a nut. 1,200 units every day helps because it's going to protect yourself. Sunbasking is good. Absorb some vitamin D. Vitamin C deficiencies, more bruises are going to happen to you, because those people that are blood deficient of vitamin C, body deficiency of vitamin C, have weaker blood vessels and weaker skin. Vitamin P is important. It is what is found in the bioflavonoid. That's how to prevent this. Let's go. Easy bruising, I'm not going to talk about that. It's almost the same thing, but it's called echymosis. Improve your diet and use alkaline and mineral dense natural foods like alfalfa in forms of tablets or powdered 2 to 3 times a day. Vitamin K that we get from cabbage and green leafy vegetables to help with blood clotting. Vitamin D naturally comes from the sun. Make sure you have sunbasking as you are able to, and avoid allergies, and liver and kidney disorders and anemia must be settled. Let's go. Let's go. Let's keep that up. Helpful herbs. Burdock root. We learn about burdock root. Aloe vera, the best skincare product out there in nature. Cayenne pepper, kelp, white oak bark, garlic, alfalfa, and rose hips have been found to be very helpful for easy bruising. Let's talk about cuts, fresh cuts, wounds, and graping, and these are scrapes, not scapes, scrapes. If you scrape, you happen to scrape your skin. And then we have septic wounds, that is in the third picture. Denzel. So we're looking at a cut, deep or superficial, a scraped skin, torn skin, either from collisions, from falling, glass metal estrates, etc. How do we treat them? If the wound is small, the blood is left to trickle out for a short time, and then you clean it. If it's a small wound, the wound would cleanse better. If it's a larger wound, then I believe we're going to have some drills on first aid to stopping bleeding. But let's say you have punctured, you have a deep incision in your finger, then or down at your leg, and you probably ruptured a vein. Then you have to elevate that limb so that blood is pushed favorably towards the heart. That way, you undermine blood flow to the punctured or the area of trauma. But cuts that are superficial to the skin, you want to clean with soap and 3% hydrogen peroxide. That is pharmaceutical grade hydrogen peroxide. Hydrogen peroxide works to arrest bleeding. Golden seal root powder, golden seal is a good herb. It actually stops bleeding and promotes healing. The other one that I haven't included here that is an expert in stopping bleeding is a herb going by the name shepherd's purse. Better yet, you can walk into any supermarket and purchase cayenne pepper and just stuff it on the open, fresh wound or cut until it stops. You can bandage it there and leave it for several hours. But the best that I've found to be working in stopping surface wounds resulting from cuts, either deep or superficial, is paprika. Paprika is a certain type of pili hoho that has blood clotting ability, works almost instantly. After the wound is been bathed, then we can, let's go back, Kidogo. Then we can use aloe vera, comfrey, plantain, molasses, or honey to wound it up, to pull the skin together. That's why aloe vera works. Yeah. Let's go. So the detail that we have is interesting. When you have an arterial cut that is deep, you apply pressure directly to stop the bleeding in the area. Then the blood spurts with each heartbeat. Do not panic. When you panic, you get into adrenaline rush and blood oozes out quickly because of vasoconstriction. So whenever you have a deep cut or you got bit by a snake, don't panic, because then your heart will change its pumping end. When we have tachycardia or fast heartbeat, then blood continues to trickle out in ways that undermine clotting. Let's keep. So those are details on how we can arrest bleeding. Then when in the event that there is an inflammation or redness occurring, there's a strong tea, golden seal powder is best. Take it, soak it for 10 minutes, drink it. You can use that up to 3 times a day. But you can also soak it in the injured area. Green herb. So this is fresh golden seal, or the powder is good. So put golden seal to the area. Golden seal has an astringent effect to the skin. Astringent means ways that try to make the skin firm, and so it squeezes to try and make the skin less permeable. And then that way you're trying to undermine blood flow out of the artery. If you puncture a finger and it's cut all the way off, they say there is no help available. But if it's still hanging there by a little thread, then I advise us to use cayenne pepper and even preferably paprika, and then you'll not need to stitch that hand or to get it off. Take vitamin C orally, up to 5 grams a day. That's 5,000 milligrams. Tea tree oil is good for preventing infection, and then reapplied every 2 hourly or 3 hourly. To expedite healing or to encourage healing in a fast rate, you apply vitamin E locally. So you got to purchase vitamin E, aloe vera juice, or comfrey poultice. Done with it. Done with that, Denzel. So handling septic wounds. Let's go to the first picture. That's a diabetic wound. What's happening? You don't want us to see. Yeah. I need to explain. E-class lazima watu wazoee hizi sites. Hiyo ni septic wound, diabetic gangrene. And these ones are the ones I've dealt with. Mimi sijatoa hii picture kwa kwa internet. Hii ya pili ni fungal infection that is gangrenous. Inakula mkono mpaka ikate. Huyo alikuwa anatumia I think drugs. The next picture is a septic wound ya breast cancer to the left of the screen. And then the second one is a ruptured tumor, a leg tumor, which we handled in 2020. By the way, this guy survived. So how do we handle such a wound? These are the things we're preparing you for as you work out there as medical missionary. Isaiah tells us that these are spiritual stuff. Why should you be stricken anymore? Why should you rebel more and more? In other words, what are they rebelling to, Denzel? They are rebelling to the health message because God is talking to them about health. He's saying, why are you rebellious to my ways of mollifying you? The whole earth is sick. The whole earth is faint. From the sole of the foot even unto the head, there is no soundness in it, but wounds and bruises and putrefying sores. They have not been closed, neither bound up, neither mollified with ointment. So Isaiah here in the 6th verse in 1st chapter is hinting us and is telling us, how do we deal with wounds and bruises and putrefying sores? They need to be closed. That is a poultice. Bound up and closed, and then mollified with ointment. So you need to oil them with ointments. I mean, apply ointments upon the wounds to suck up these infectious material. So sugar poultice is the first and probably the best in terms of a septic wound. Sugar, sukari ya duka sio chakula. Sukari ya duka ni dawa ya vidonda kwa sababu inaua cancer cells ama bacterial gangrene. Ina dissolve and then it turns into a liquid and then oxidizes. When it oxidizes, it pulls out infectious material. But usitoe mwaga sukari kwa hiyo kidonda, hata kama kuna wadudu wale wanatembea maggots, itawaua in no time, itaua harufu in 2 minutes time, hautaona hata nzi ikikaribia the septic wound. Lakini mwaga hiyo sukari mpaka wakati ambapo sasa haikui maji. Alafu funga bandage kwa hiyo sukari. Sugar is a disinfectant. It's toxic both to the bacteria and the cancer cells as well as your own body cells. But because we don't have integrity on a wound, that sugar will not cross into your system. It's simply going to kill surface cancer cells and pathogenic bacteria. And then what it does, it also activates lymphatic system. So ukiwa na mtu ako na elephantiasis, mguu imefura ile kubwa kama ya elephant, unafunga sukari kwa mahali, maana huwa za kidonda ziko na little pockets, little vacuole full of fluids. Sukari itavunja alafu ita activate the lymphatic vessels to drain the lymph. The lymph is what carries your bacterial agents that are causing pathogenesis ama cancer cells in there, na inazidrain zote. Once this is achieved and you have redness back to the wound, that means it's fresh and blood is flowing into the area, then this is what we do. We use 2 herbs, incredible for wound healing. They form a scab. A scab is a dry covering to kind of close up the wound. That is golden seal and maya. Or if you don't want to use golden seal and maya, and if they are not within reach, we resort to honey. Honey tends to reduce the circumference of the wound. It has invertase bacteria, invertase enzyme, pardon me. Invertase enzyme helps to speed up healing, and turmeric and ginger, or molasses or comfrey oil. The sugar procedure might take up to 2 weeks to obtain freshness of the wound. You do not want to close up a wound where it is not fresh. If you do that, the wound is going to transfer its pathogenicity inside your vessels, and then you have a wound internal. That's so dangerous. So let the sugar completely drain the wound, achieve the fresh blood. One thing we can complex the sugar poultice with is povidone iodine and DMSO. DMSO is a plant chemical that is so important for wound healing, but has very good penetrability into tissues and membranes. And second to that, DMSO is so good, it carries your herb into the target site to initiate healing. Sugar poultice, don't forget about it. Tumia sukari kutibu vidonda haraka sana. Tuendele. So kitu cha kwanza Denzel, hawa watu wetu wanafanya ni wakipata kidonda inanuka, iko na wadudu, inakuliwa ni kubwa, mwaga sukari. Kitu cha kwanza usisahau hiyo. Ukifunga hiyo poultice usiku, asubuhi ukiamka, fungua hiyo poultice, alafu tengeneza hii sterilizing liquid. Inatengenezwa na hiyo sterilizing liquid ndio unatumia kuosha vidonda, unaosha the pus, unaosha the oils that are being produced, unaosha uchafu ya kidonda. Lemon juice, na umechemsha tangawizi, umeweka garlic ndani, umeweka kitunguu, umeweka nini moja, waru moja na Epsom salt ama pink salt. Angalia, those are antiseptics. Lemon juice is a powerful antiseptic equivalent to isopropyl alcohol. So hii unaosha nayo mguu polepole vizuri mpaka ing'ari, na unatoa mahali hiyo lemon inasaidia kutoa mahali imekwama iko sticky, na kuna they usually yellowish fatty deposits ya uchafu. Hiyo lazima utoe. Usipotoa hiyo haina shida, and the wound has to be fresh and red. Na mtu atasema oh, kuna usikungu. Simgonjwa anasikia uchungu. Uchungu iko maana ni kidonda. Hata usipoosha bado kutakuwa na uchungu. Tunaelewana? So unaosha hiyo mguu na sterilize mara 2 asubuhi na jioni. Within 2 weeks unafunga poultice. Now, after ushaiosha, kabla kufunga poultice, you have to do more. This is what you do. Bonda kitunguu saumu na kitunguu ya kawaida ya maji, kulingana na ile size ya kidonda. Bandika, itachoma. Ikichoma hivyo inalete damu to the surface. Damu inapokuja kwa surface, what you're achieving here is you're bringing in your white blood cells to the area. Usichome mgonjwa sana kwa sababu ata give up na hii matibabu yako. So weka for 2 to 5 minutes, alafu run off with cold water. Ondoa hiyo kitunguu maana inamchomanga haraka. And then follow that with crushed or grated beetroot. Beetroot haiwashi, beetroot si uchungu, lakini inaua surface cells. This is why we leave beetroot paste on these septic wounds for up to 30 minutes. Then you wash off. After you've washed it off, then they'll scroll. Ukishatoa beetroot, sasa una massage hiyo mguu na massage oil. Massage oil nimewapatia kwa formula. Unatengeneza aje? Unachukua olive oil, unaweka na castor oil. Alafu unaweka cayenne powder kidogo, unaweka ginger powder kidogo, na unaweka matawi ya rosemary. Hii unaweka kwa jua siku 4, the whole day. Ndio ioxidize vizuri. Alafu hiyo mafuta utatumia ku rub gently around the wound, not direct on the wound, please. Why are you doing that? You're trying to draw blood to the area. Damu fresh ikiingia kwa kidonda, kidonda inaanza kupona. The other thing you're doing is unamfanyia alternate hot and cold baths. Unaweka mguu kwa maji moto dakika 3, maji baridi dakika 1. Hiyo inafanya blood ina flow. When blood is not flowing away and through the wound, it can't heal. 2 weeks, utaona kama 2 to 3 weeks, depending on kidonda ni ya nini. But don't be patient. Don't be impatient. Exercise patience. If you have to continue with the poultice until 3 weeks or to 1 month, that is it. Don't give up. The moment you see the wound is red, fresh, and is started to dry up, I told you uchafu, then you bring in your golden seal and Maya paste or turmeric, honey, and ginger paste. And when you do a poultice or a paste of this, you have to enclose with a bandage. Funika hiyo kidonda. Ukifunika ni kana kwamba umeleta ngozi nyingine. Sasa ukileta ngozi nyingine ufunikie kidonda, the layers we talked about of the skin zitaanza kukuja juu, and that new layer inasaidia kidonda kuproduce a new layer of the skin, alafu itakuwa umeponesha hiyo kidonda. So usiharakishe kutoa poultice ya asali ama ya turmeric na asali. Weka ikae siku 2, osha, sterilize kidonda, weka nyingine. Kama unatumia golden seal and Maya, you should only leave them there for at least 2 days. Repeat this until we got desired results. Other poultices unaweza tumia kama hauna hizo vitu nyingine, although it will be slower, ni charcoal poultice. And you don't pull charcoal direct to the wound. You have to enclose it between a cloth or between kitchen towels to avoid scarring. Ndio kidonda isipone ikiwa na scar. Ama tumia comfrey paste. Comfrey paste weka direct. Comfrey is so good, the kidonda heals so fast. The other option is you can use the oil. Fresh comfrey paste, that's the primary solution. Unless you don't have the fresh leaves, then you resort to the oil. Kitu kingine ambacho watu tunatumia kuosha kidonda ni carrot juices ama comfrey juice. Hiyo unaosha tu nayo kidonda every day. If it is a fresh cut, ukipaka molasses, blackstrap molasses, the wound heals in a few days. Let's go. Hii usisahau, emergency deep wound care. Mtu amekatwa na shoka karibu the big toe inaanguka. In fact, when we were, about in 2019, that's about 6 years ago, we were in Machakos and kulikuwa na watu wawili actually. Mtu wa kwanza alikuwa anapasua kuni na shoka ikakata the big toe, ikabaki kidogo hivi karibu ianguke. Na mtu mwingine alikuwa ni mtu wa boda ambaye alipata accident. Hii jaw ya meno ya mdomo, the lower jaw, ilikuwa ina hang. He was scheduled to go back for corrective surgery within 2 weeks. Akakuja kwetu, tukamwambia usirudi. This is a miracle. This is what we used on this guy. Tulimpatia cayenne pepper, tukaweka molasses na tukampatia moringa. Within 3 weeks this guy, hiyo jaw ilishikana, hakurudi kufanyiwa surgery. Huyu jamaa mwingine pia tukamwagia tu cayenne pepper kwa hii vidole vya magoti ambavyo vilikuwa vimeanguka. So hiyo sija include in the slide, but nimewaambia we have multiple choices to do this. So this fruit, hii fruit inaitwa aje makori? Bitange Jane. Oh, watu wanalala. Redemptor.
Which fruit are you asking about?
Look on the slide. Hiyo fruit inaitwa aje?
My slide is blank, there is nothing.
Hatuna hiyo slide, hata mimi sioni.
Denzel.
Yes. The slide should be visible to everyone. They should probably check their network.
It is visible.
Nauliza hiyo ni fruit gani?
Grapefruit. Hiyo haina local name.
Grapefruit ni matunda kubwa, ukienda kwa supermarket unapata inauzwa bei ghali. Lakini pia siku hizi naiona kwa markets
Kiswahili inaitwa chunga kikubwa.
Ndio hiyo sasa. This is a very powerful, other than just using it here for wound care. Did you know grapefruit ni dawa mzuri sana ya cancer na pia ya malaria? Hii ni dawa nzuri ya malaria. Hamjui? So anyway, na respiratory issues. How do you use the grapefruit kwa mtu mwenye akona cut kubwa sana? Immediately wrap a bag of ice kwa hiyo mahali imeumia kama kuna intense bleeding. Number 2, chemusha grapefruit kwa dakika 5 ama dakika 10 kwa maji ambayo umeweka Epsom salt, ile chumvi ya ng'ombe kufanya ng'ombe aendeshe kama kuna constipation. Quantity, unachukua vikombe 3 vya grapefruit. Grapefruit moja na vikombe 3 vya Epsom salt. Chemusha. Alafu toa hiyo nyama ya grapefruit. Hiyo nyama yake ukitoa unaweka kwa hii nini? Kumarinate inamaanisha unaichemsha polepole kwa hiyo chumvi. Alafu kisha hiyo nyama unaweka kwa kikombe, alafu utabandage hiyo kitu kwa the deep wound. Apply quickly immediately kuna injury, you'll not need to stitch. Bandage the grapefruit to the affected area. Alternatively, as I mentioned earlier, kama hauna grapefruit na kidonda ni deep cut na utaki ashonwe, unamwaga cayenne pepper mingi, na niliwaambia kuna ingine ina work more than cayenne pepper, inaitwa paprika. Ina stop bleeding. Pia akinapoendelea kubleed, hiyo cayenne pepper changanya na paprika na mpatia kunywe. Ama umpatie shepherd's pass. Kuna dawa inaitwa shepherd's pass. Ama alum root. Hizi zote unaweza soak pia hizo herbs ukiwa na soft powders kwa inaitwa cotton wool alafu unaweka to place kuna wound na ita stop the bleeding. Then let's go. Kuna hii shida inaitwa intertrigo. What is intertrigo? Intertrigo ni rubbing together between the groins, the breast, the underarms and the thighs. Wanawake wenye ni wakubwa, they have this problem, they know. Shida ni kwamba if there is a rub, especially between the thighs or in delicate places, bacteria na yeast inaweza mea up na inaweza kulete ulcer, kakidonda kidogo. Overweight women are the most affected because huwa wanatoa sweat nyingi, na pia wengine ni wale wenye wako na loose bladder, so wanashinda labda wamejikojolea kwa kutojua. Kwa watu ambao wako na ugonjwa wa kisukari inaweza leta secondary infections, na in temperate climates kama hii ya Kenya during the summer, hiyo shida inaweza kuwa. How do we treat intertrigo? Keep the surface clean, dry, free of friction. Use natural chemical-free soaps, deodorants, and other products to place on your skin. They are available from health stores. So aloe vera is very good for intertrigo, by the way. Let's go. Useful herbs include chamomile tea. It soothes the skin, fights bacteria, and helps the healing to occur. Aloe vera gel is good. Tea tree oil is an addition to the list. Use those ones liberally. Let's go. The other problem is this, swelling. Mtu amefura tu ghafla kama hao watu wetu wawili. It can be caused by a bruise, amegonga mahali, ama sprain, ama an infection, ama inflammation due to arthritis, ama maji kukua accumulate, inaitwa edema. Treatment. Bromelain is a powerful plant chemical from pineapple, fresh pineapple. Bromelain iko anti-inflammatory. Mpatie bromelain tablets ama mnyweshe sarubati ya nanasi 3 times a day, at least a glass. That undermines in a swelling either due to allergies or the aforementioned. Or you can make a tea of chamomile or comfrey or white oak bark, dill seeds, or oregano. You can drink and as well as you apply externally. And then chukua kitamba ama face towel kama ni uso kama hii. Towel mbili, moja ni ya maji moto na ingine ni maji baridi. Unaweka kwa uso, unafunika towel moto baridi to activate the flow of water, not water really, but of blood. Potato poultice. Raw potato poultice over the area is helpful. Potato is alkaline, it will draw out all the swelling. The other thing that you can take that probably if the swelling is due to allergy ni cayenne pepper, ama artemisia, ama kile ambacho tunaita stinging nettle swelling. Haya. Kama kuna scar unatibu aje? Patia huyu mtu vitamin E. Apply aloe vera kwa hiyo scar. Sana sana hizi scar ya kina mama, hiyo ya chini ni ya cesarean section ama scar ya kukatwa kama hiyo ya mkono ya juu. Vitamin E ukiapply hapo ni mzuri. Unaweza kuapply castor oil. Yeah, scars heal by the way, but it takes time though. It takes time. Let's go. Ulcers, sores, and burns. Let's begin with blisters. What is a blister? Rounded, fluid-filled spot. Like I think I have a blister. I got burnt recently with a hot molasses. What causes blisters? They are frequently caused by wearing different shoes or excessive handling of tools. Kama ni kwa mguu. So a blister, just a pocket size of rounded fluid-filled spot. Usiprick. But kama ni kubwa ndio utaprick. Hiyo maji itadrain. Wakati ina drain, sana sana kama ni blister tuseme ya magoti, funga poultice ya charcoal ama ufunge poultice ya potato. Ndio isikuwe infected blisters. Let's go. Kuna sores, abscesses and pus. How do they present? They present sores that do not heal, and abscesses, which are large and pus-filled pockets. And it's like they're not just going away, they're stubborn. And then over time, the skin condenses into an open ulcer. The swollen part becomes inflamed and it's tender. And then it could produce fever and chills because basically pus indicates massive presence of bacteria. And then your white blood cells are coming there and are trying to fight them, so you could get fever and chills. An abscess can form on the surface of the skin or within the body, like in the sinuses region, or in the teeth, or in the gums, or in the tonsils, or lungs, or brain, or down in the stomach, abdominal walls, or in the GIT, in breast and kidneys, etc. What causes abscess and pus? Poor living conditions or bad diet, innovation. Somebody that's innovated is an individual that doesn't move, so the nerves are lazy. Lack of rest when you're worried so much, exhaustion, or toxicity in the body, toxemia. It may as well be caused by an infection from a wound, an illness, lowered resistance. That means your body is susceptible or vulnerable. Certain form of drugs, food allergies, stress, or junk food. Drugs that contain sulfur have been found to precipitate abscesses resulting from boils. So let's explore this. Leg ulcers are a special problem. They're open source. They develop on the legs, sometimes due to varicose veins. So there's poor circulation and breakdown of tissues. Treatment, vitamin E, because it works on your cells, 200 units a day. Apply a dressing of fresh comfrey leaves to the sauce, or put a paste of raw garlic for 8 to 10 hours. Then a boil, medically it's called a furan coil or a carbuncle, follows the directions below for an abscess. By the way, I had abscesses because I used to drink a lot of milk. So I had carbuncles and furuncles, and I actually had up to third line antibiotics to beat them, and it could not go away. When I stopped milk and all dairy products, that is how they went away. Wale watu wa maziwa na mayai na kunywa pombe wako na hizi shida. Tuendelee. Surface abscess, kuna boric acid, a poultice of boric acid. Boric acid is good. Kama una boric acid, unaweza kutumia echinacea. That's a herb you learn about echinacea. Or unafanya clay poultice. Wengine wanatumia flaxseed poultice. You can complex the flaxseed poultice with charcoal. Vitamin C to boost your immune system. That's important. Alongside vitamin A and vitamin B complex and vitamin E. Rest a lot of time. Drink lots of fluid to help flush the system. Clean the bowels. So you can do an enema once a week, or you can do a colon cleansing herb like a laxative, maybe Senna could do. Stay on a vegetarian diet to avoid inflammation. Avoid heavy starches. Situmia a lot of starch. Ugali mingi wachana nayo. Undimana labda uponi kwa sababu zina produce acid. The acidity trickles down into your tissue at the tissue level, and then you don't heal quickly. We are singling out chocolate, sweets, na saturated or hydrogenated fats as a major drawback in diet. Avoid those ones. Avoid them. Why are people leaving the meeting? Are we understanding what is going on? Ama shida iko wapi? Tunaelewana watu wa Mungu?
Yeah.
Tunaelewana?
Naona watu wakiondoka.
Hizo ni bando tu zimeisha, wananunua.
Oh, sawa. Aya. How do we do a brief juice fast? Usikule chakula solid, kunywa juices. Either ya fruits, but preferably vegetables. Alafu, alternate hot and cold showers every morning and evening. Oga na maji baridi na warm. Baridi, warm. Baridi, warm. Wakati unapooga. Ndio hii damu izunguke itoe hiyo uchafu. Chlorophyll is good, garlic is good, and kelp is also good orally. Lenzel, let's go. I don't have the time. drink distilled water, blah, blah, blah. Slippery elm, that's a herb that is good. Lobelia, that's good. All right, let's go. And echinacea and golden seal. We're going to review all of these things when we get these things. So angalia hizo zote nimewaandikia hapo, hizo wanafunzi watajisomea. Twende. Ulcers hii ya mdomo mnajua, si ndio? Na ni uchungu sana, si ndio Naomi?
Yeah, kidogo.
Unaiona?
Yes, inaonekana.
Si watu wanakuanga na hizi shida sana sana wenye wanatumia maziwa ama wenye wanatumia toothbrush yenye ni mzee yenye iko infected. What you need to do is with aphthous ulcers ama zinaitwa mouth ulcers ama canker sores is then say let's move the screen is this give me the management please. Golden seal powder or golden seal tea bag. Umepata hii herb ya golden seal ni mzuri. As a matter of fact, for information, golden seal is the most effective herb for mucous membranes. So kama shida ya tumbo ama ya skin ama ya wapi, don't forget about this name golden seal. And then it also drains the lymphatics so well. However, don't take golden seal for more than 2 weeks. You can always be alternating it with what we call it, echinacea. Apply golden seal powder, gargle it and spit it out. It may also bring relief to your pain. Wash your mouth with plain hot water to draw healing blood and help relieve pain. This is simple hydrotherapy treatment. Or gargle, Denzel unaweza andika hapo, gargle cabbage juice. Other than cabbage juice and golden seal, squeeze kwa hiyo kidonda ya mdomo vitamin E oil. Kwa hivyo hii vitamin E oil kila medical missionary anapaswa kuwa nayo. As soon as the first tingle is felt, 500 mg of vitamin C with bioflavonoids, do it 3 times a day for 3 days. Utamalizana na hii kitu. Aloe vera pia ukiapply mara nyingine ni mzuri. Scroll. Up to ulcer. Scroll it. Prevention tutajisomea. Cold sores, we will skip here. We don't have time for that. Cold sores, rudisha cold sores kidogo. Cold sores ni viral infections actually. But I wanted to say like herpes virus is very notorious for cold sores. Now, there are also other causes as well. Stress, scroll Denzel. Stress has been found to be a key trigger of viral sores. That's the words we have in red. I'm basically referring to what we've written in red. When you eat too much sugar, you could trigger a cold sores. Excess UV light, kutoka kwa jua ama kwa any other machine or electronic can be okay, can be the real cause. Acidic foods also trigger cold sores, kama pombe. Poor diet have also been singled out. So canker sores or cold sores, they are so important that we know how to manage them. Let's scroll then. Treatment. The treatment is here. Raw vegetables, vegetable salads are good. Zinc is important. Vitamin E application is important. Amino acids like lysine. Lysine, by the way, it's so important for a cold sore. Lysine, that's a supplement. And then protect your lips from sunburn and wind. Do exercise and have adequate rest. Helpful herbs, golden seal, echinacea, red clover, podiaco. Tutasoma hizi herbs jamani, tuendelee. Boils, medically referred to as carbuncles and furuncles. This is common, fairly common. They could be itchy, producing mild ache and elevating swellings. Kwa kichwa inakuwa sana, ama the butts, ama the underarms, kwa armpits, ama kwa uso, ama hata kwa in the groin area. Within 24 hours, by the way, furuncles and carbuncles are little boils. Hizi ni ndogo ndogo na zinaweza kuwa nyingi. Kwa groin area, kwa nywele ya sehemu za siri unapatanga sana carbuncles and furuncles. Na ziko pass filled. Unaambiwa usifinyilie jipu mpaka iive. Those guys were right. Basically, ni uchafu imejikusanya kwa lymphatic glands, the lymph nodes or the lymph nodes. Boils are tender, they are red, they are painful, they appear kama huko unatarajia. Ziko na pus, ziko ndani yao na zinaweza kuwa infectious. Hiyo ndio maana tunawaambia usisqueeze. Ukisqueeze hiyo pus ikimwagika on a fresh skin, another boil may start. And the reason why ukisqueeze na uache kabla haijaiva, boils are within the lymphatic system, they'll travel and infect another area. The most dangerous boils are the boils that are in your stomach. Na kuna watu, hiyo inauanga watu, ziko ndani, haziko nje. Unajua boils zinaweza kuwa ndani. So, especially those of us who sometimes are dealing with HIV and AIDS patients, some of them present in stage 4, HIV and AIDS World Health Organization staging, wanakuanga na hizo boils. So, do not drain the pus to get on the skin or elsewhere, because it'll let a little more boils called carbuncles. Untreated boils tend to exude their poisons and disappear within 10 to 24 days. But given careful treatment, they are contained and less severe. But a boil can be so painful, especially when it's in the butt, you can't sit down. Let's scroll down. Keep in mind that if the body is trying to expel a poison like sulfur through the skin, you may continue to have a string of boils for a time. The body is trying to cleanse itself of something bad. Inorganic sulfur in the body is especially prone to come out in skin boils. Na hii huwa inafanyika na wale wenye wanatumia Septrin, kwa sababu Septrin na malarial drugs ama antimalarial drugs zinakuanga na sulfur, ama zile sulfur ambazo tunapata kwa skin applications. Danza. Treating boils, look at the herbs. Comfrey orally, red clover, yellow dock. Yellow dock is a very powerful herb for boils because it's a blood cleanser. Chickweed, plantain, and wild cherrybark. The herb that has not been here, Denzel, you can write as a side note, ni golden seal. Golden seal once cleared a boil for me in 3 days. But you can do an application, an applied poultice on the boil. Every night, tumia raw potato. Tukisema potato huwa tunamaanisha waru. Changanya na flaxseed. Funga ivute. Ama unaweza weka bread crumbs. Zile crumbs za bread. Pia inavutanga boiled rahisi sana. And then, other than that, unaweza apply a moist towel yenye iko na joto, ama cloth or a gauze, 3 to 4 times daily to the boil to draw the blood together, and then it will burst, and then you'll drain it. And then it also reduces the pain and the headaches. And then it makes the pus to be concentrated in one area, and then we're not going to get infected. So let's go. Majipu. Wash the skin several times a day. Bed rest, helpful herbs are like oat straw, golden seal, dandelion, and burdock root. Hizo ni mzuri kwa boil. Safisha tu damu na hizo pia ziko antibiotic in nature, zinaua the staphylococcus bacteria that is the causative agent. Let's go. Which one is that? Bed sores. Who knows what a bed sore is? From the pews. Who knows what a bed sore is? Naona huyu wa kwanza ni kwenye makalio. Huyu wa pili ni on the side. Bed sores or pressure sores are so common, but they're so painful, especially with bedridden patients. Mwenye anapenda kulala mahali moja. Sana sana wazee. Kwa hivyo kama wewe unatunza mtu mzee na ako bedridden, lazima ukae na yeye usiku ushinda ukimpindua ndio asipate bed sore. Labda ni your grandmama or your granddaddy, they are in their 80s, the skin is sagging. Wewe wacha kusema unasumbuliwa. Na wewe wenye utafanya kazi ya wagonjwa, lazima ushinde unapindua bedridden patients. Wenye wako na pampers ama watoto wadogo na wako wagonjwa. Other than a good diet, lazima uwapindue ndio usipate bed sores. Hizi bed sores are so stubborn. Then give us the notes. There are deep skin ulcers found on the butt, the hips, the sacrum, shoulder blades, elbows, and heels. These ulcers form during periods of prolonged bed rest as pressure is continually applied to bony parts. So kuna hizo of the bony processes, mahali as the skin iko so much, I mean, you feel the bone is on the surface. Mahali unasikia kuna mfupa iko karibu na ngozi. Hapo ndio pressure source zitafanyika. Bedridden elderlies, the geriatric, or those who are unconscious, ama wale wenye wako paraplegia. Paraplegia ni wenye wamelemaa kiasi. Ndio watu wanapatanga hii shida sana. Watu pH yao iko too alkaline and directly they are deficient in vitamin A. Kwa hivyo wa supplement vitamin A, vitamin B2, wapatie vitamin E, seal na zinc pia. Na pia unaweza paka any herb that is mucilaginous, iko na makamasi. Inaweza kuwa ni slippery elm ama aloe vera, the best to mollify the skin. Let's go. These pressure sores do not heal in the hospital. This is why we are teaching you pressure sores. Weka sugar ama honey poultice kwa hiyo kidonda, hiyo bed sore. Ivute sumu. Pia unaweza weka zinc oxide ointment. That one is something you can make from home and you can buy from the pharmacy. Wheat germ oil, nimesema aloe vera ama comfrey. Usikule nyama. Make a paste of crushed comfrey leaves and slippery elm to cover the sores. And then you want to be washing them 3 to 4 times a day together with a witch hazel tea or golden seal and mire. Mix powdered comfrey leaves, excellent, together with slippery elm, equal parts. Mix them in water, apply a paste, enclose with the cloth, leave it there for some time. Overnight is okay. When it's dried up, sprinkle some powdered golden seal or echinacea over the sores. Then you'll be disinfecting them. By so doing, the disinfection helps the sore to clean and to reduce in circumference. Alafu una cover with cotton wool, ndio isifinyane. Let's go. Improve the diet, drink enough liquids, achana na processed junk foods. Do not eat meat at all. The diet should have enough fiber, and then oat bran is good for fiber, and this so that the bowels are moving every day. Avoid acidic foods to lower, eat slightly acidic foods. Kama cranberries. Cranberries, citruses give you favorable acids, and then the body is able to heal the sores. That's done. We're done with the sores. Let's go, Danza. I'm waiting for you. Yeah, you're going to read that on your own. Let's keep that. How to prevent them. Kuchomeka, a burn and a scald. Scald ni ya maji, a burn ni direct to the skin. Moto, no steam. Especially ukichomeka na steam, tumesema you've been scalded. Ukichomeka kwa nyumba ilikuwa inachomeka, that's a burn. And there are degrees of burns. So give us the notes. And nowadays it's so frequent. First degree burns, there is redness. Second degree burns, they are blisters without plus the redness. Third degree burns, the entire skin and some of the underlying muscle has been destroyed. And then third degree burns, immediately you have to go to an emergency room in a hospital. Even more extreme is the fourth degree burn. Instead of oozing flesh, the area is dry and that's been charred. Inaanza kutoa coal. Tissue damage results because of the heat, either chemical, electrical, or radiation injury. For first degree burns, where there is only redness, usually it's as a result of the sun. It's a sunburn or from water. Second degree generally results from hot metal objects or contact with flame. Third degree burns, hot fluid burns, steam from a pressure cooker, electric burns, or high flame contact. These are very important. So caution, never ever touch a burnt area with your bare hands. Break blisters and remove loose skin. Use adhesive or dry fluffy clothing. So mtu akichomeka immediately, the first thing unamwrap na blanket. Apply anything. Do not apply lotions and ointment to the burnt area. Denzel, you'll correct that. Do not apply, please. Apply water under pressure. Do not apply water under pressure. Don't correct it. The statement is correct. Remember, don't correct it, please. It says you should not apply anything. You should not apply water. You should not break the blades. I think it's correct. It's correct. Don't correct it. Let's go. Treatment first degree, tunatumia white vinegar, tunachanganya na maji in equal parts, alafu tuna cover the burnt surface twice a day. Aloe vera ni mzuri na vitamin E locally, ama ile mafuta ya cherahani tunaitanga kwa kijaga mobunde. Wale ambao wanatumia cherahani wanajua. Tannic acid is another one. It's used in clinics for surface burns that are healing already. But sisi tutatumia white oak bark tea, that's a herb. Una apply to the local area and then you do a wet compress over the burnt area. Second degree burns where there is redness and certain blisters, una apply vitamin E or zinc oxide, unachukua vitamin C orally, and then you apply aloe vera to speed up the healing. Third and fourth degree burns, take the person to a professional. Do not remove clothing. But I'm told if you don't have an hospital around, then cover the body with a blanket as an emergency. Alafu mweke potato poultice. I'm a smashed cabbage, I guess. And then you apply aloe vera after healing. There could be infections, the pneumonia, due to burns, so just make sure that there are no infections. Soak the clothes, so apply cold until pain subsides, cold water. Pia ni mzuri, ina reduce pain and swelling. You cover the burn to reduce likelihood of infection. Mix and apply olive oil with baking soda to the area. Elevate the area. That's for first degree. Second degree, you require protein diet to rebuild the lost tissues up to 5,000 calories a day. Kwa hivyo mtu amechomeka akule, ndio to granulate ama ku precipitate a new layer to form. Vitamin A, B, C, E, and F have been found to be important, especially when you're applying vitamin E. Use a spray or a solution up to 3% of vitamin C together. Every 2 to 4 hours is helpful. These notes mtasoma on and on ndio mjue. Let's go. Skip that. I don't have time for that. Eczema. Eczema tunajua stop wheat, stop milk and milk products, stop, what else do we stop? Stop animal proteins, stop ngano. What is good on eczema? Let's go for treatment. Eczema huwa tunatumia B complex vitamins. Eczema tunatumia shea butter. Tukisha stop hizo vitu zote, tunatumia coconut oil. I've included every other thing else in the list there. For eczema, na huwa inasumbua watoto. Mtoto anajikuna mpaka kama ni dry scaly, that eczema is terrible. Wacha kupatia watoto maziwa ya ng'ombe tafadhali. Plantain is important. Chickweed is a good herb. Golden seal ikichanganywa na vitamin E, apply on the eczema. Burdock root, yarrow, strawberry leaves. And then unaweza kunywa nama unaweza apply kwa hiyo eczematous skin. Yeah. Skip. Urticaria, I'll not cover that. Hiyo ni rash. Hiyo ni naitwa allergy rash. You leak it in shingles, herpes zoster. Ni mbaya sana watu wenye wako infected with HIV and AIDS experience a lot of herpes zoster. Looks like that. How do we handle this? Just treatment, 1,000 milligrams of vitamin C 3 times a day. And then there is another supplement that's called rutin and B complex, calcium and lecithin, amino acid, lysine. I told you when you're talking about herpes, viral infections to the skin, do not forget about amino acid and lysine, which is another very specific amino acid. It inhibits the spread of herpes virus. Your diet must include raw fruits and veggies, brewer's yeast to support the nerves, brown rice to move the fiber to stop affecting the body, and whole grains. Do not blister them. Do not be bothered by the blisters, kwa sababu mtu akiwa ako blistered hivyo anataka kuzishika, mara anataka kucover up na nguo kama ni mama, wachana nayo. What you can do, apply vitamin E kwa hizo blisters. Unaweza, na zinakwanga uchungu sana hizi, by the way, chunga sana na herpes blisters. Put cold water on a cloth and place it over the area. When you cool them, it feels better. Avoid anything that will make the blisters hot. Hii ni kama blisters za chickenpox. Ukikaa kwa jua ndio zinakuwasha zaidi. So cool the body. The other thing that is not included here, Brother Denzel, for the skin is applying eucalyptus oil to those blisters, whether it is a herpes, or whether it is a chickenpox, you're going to get the help. The other thing you can do is oga na maji yenye iko na eucalyptus leaf ama iko na neem, na itaanza kuhandle hizo viruses vizuri. Tuendelee. These are other things, apple cider vinegar. You realize that we're not actually going through every notes here. So it means you have to read, because is in the most condensed information on how to manage these issues. Colloidal silver, oatmeal, you can buy them from the pharmacy, put them in the bathtub, soak them in there for as long as they can, 2 to 3 times a week. Apple cider vinegar is good. Move it. Leave that alone. Those ones they're going to read at their own time. Psoriasis. Let's go to management of psoriasis. Psoriasis management. I mean, we want treatment, brother. Dancer. Hiyo ndio psoriasis venye inakaa. Treatment, you don't worry about psoriasis. Change your diet. And I've found neem oil to work very well for psoriasis. And olive oil works for psoriasis. Kwa hiyo olive oil unaweka cayenne pepper. So you can write olive oil with cayenne pepper. Very good for psoriasis. I mean, it looks bad, but you don't have to be bothered. The more you're stressed, the more it is aggravated. Let's go. Too much information here that we don't have time to go through entirely. Hizi zinakwanga allergies. Let's go. I don't have time for this. Avoid butter, milk, cream, eggs, and meat. So that's why I mentioned that this is a form of allergy. The foods that we have enlisted here are very allergenic in nature. White flour, sugar, and citrus fruit. Citrus fruit ni kama machungwa, ni kama passion fruit, ni kama sandara, ni kama pixie. Hizo zinaweza kuwa ni shida. Red meat and dairy products contain arachidonic acid, which flares up, lesioning, turning red, and swell. And then mafuta mbaya. Pia. The treatment for eczema you'll get in the notes, please. You'll go get it in the vitiligo. Vitiligo, Denzel, give us the picture. It's in the next slide. Hiyo ndio vitiligo. Go to the management. Unatibu aje vitiligo. Treatment, B complex supplementation, B vitamins, PABA, it's called paraminobenzoic acid, 100 mg 4 times a day. Other helpful nutrients that you want to concentrate on are vitamin A, B complex, B12, zinc, copper. Other remedies, lotion made from tea tree oil or rose hip. B group of vitamins taken by mouth, carrot juice every day, 1 to 2 for 1 to 2 months, and then turmeric powder daily. Hiyo utafanya hivyo for like 6 months, utaanza kuona changes, plus liver detox kama dandelion are good. Warts. Look at warts. The next picture, your warts. I think if you scroll through, we're going to see warts and how they look like. It's on your warts. How do you handle them? Give us the notes. Ndio hiyo. Vitamin A, vitamin C. Mostly warts are as a result of papillomavirus if they're not hereditary. And vitamin A, C, and zinc have all been related to increase, to decrease the incidences of viral infections. But you can rub the warts with garlic, fresh garlic that you have chopped a little bit. The garlic oil, the allicin, will disintegrate the warts. But the one that works really faster is euphorbia milk. Euphorbia. I don't know what's euphorbia, but naona ile green shrub ambayo ilikuwa inatumika kufence boma na inatoa maziwa. Hiyo maziwa ukipaka hapo inatoanga hiyo warts haraka sana. So usishinde hapo na warts. Let's go. All of this, you're going to have to meet a lot more than what we need. Raw garlic is to be eaten every day, notably, something that we can easily achieve. Cover the wart with honey for 15 days. That also works. Castor oil appears to disintegrate the wart within 3 weeks. And try out some of these things. You can note that what works for you best and quicker is what you want to go with. Let's go. Pass. All of this is the information for the student to integrate. So lazima asome acne. Acne in a lower self-esteem. Vijana wale wako kwa adolescents wako na acne. That is acne due to hormonal imbalances. But acne can present as a blackhead or a whitehead or as pustules, infected nodules, sacs, and cysts. They occur within the sebaceous glands, and if you keep on squeezing them, they leave a bad scar on your face. So acne can also result as a result of vitamin A deficiency. Vitamin A deficiency, or kama unatumia vyakula ambavyo viko na mafuta kama mafuta mbaya kama pork na hizi saturated animal fats, utakuwa na acne. So tuendelee tuone venye tutamanage acne. Echinacea tea every day. I found that to be very helpful, but you need less sugar, less cow milk, fewer fats, more zinc, 30 to 50 mg per day, and more vitamin A, which is quite crucial. All right. Brewer's yeast can help with zinc. Walnuts and squash and sunflower seeds are also equally a good source. Other than that, there is the management which we're looking up to. Let's scroll. Yeah, scroll further. Is that the last slide? Yeah, seemingly. That's the last slide. So I've skipped a lot because of time, but you all, those are very rich notes for the things that we have learned today. And almost every other skin condition, you will need to use almost repeatedly those supplements and the herbs that repeatedly were featuring. Now, don't forget about aloe vera. It's the single most important skincare product. Don't forget about aloe vera. Don't forget about neem oil. Don't you forget about eucalyptus oil. I'd want you to remember golden seal. And remember that you have to cleanse the liver, the gut, and the blood. And then you're going to have to be patient when you're dealing with skin conditions. I need some few guys to ask questions. Then we can call it a night.